If you're over 60 and living with diabetes, I need you to hear this carefully. That heaviness in your legs when you stand up. That strange weakness when you walk to the kitchen. That fear that your legs might just give out on the stairs one day. It's not just getting old, and it's not always neuropathy like most doctors quickly tell you. In my 30 years of working with seniors, I've seen the same pattern again and again. Good, honest people who did everything right. They took their medication. They watched their sugar. They even walked every morning. And still, week by week, their legs felt weaker. They started avoiding the grocery store. They stopped visiting friends. Because deep down, they were terrified of falling, of losing their independence, of becoming a burden. And the most painful part? When they asked their doctor, the answer was often the same. It's just age. It's just diabetes. There's nothing more we can do. But that is not the full truth. You see, there are 5 silent reasons your legs may be losing strength after 60 with diabetes. And the third one is so overlooked, so quietly missed in regular checkups, that I call it the invisible thief. It doesn't show up on a standard blood test. It doesn't scream for attention like high sugar does. But slowly, night after night, it steals the strength from your legs, your balance, and your confidence. And here's what breaks my heart. It's also the easiest one to fix once you know what to look for. I've seen patients in their late 70s regain their strength in just a few weeks, simply because we finally addressed this one missing piece. They went from needing a cane to walking their grandkids to the park again. Now, I am not here to sell you a miracle. I am not your doctor, and this is not medical advice to replace your physician. This is education from one human being to another so you can have a better conversation with your doctor. Because when you understand what's really happening inside your body, you stop feeling helpless. You stop blaming yourself. And you start taking back control. So if you stay with me for the next 40 minutes, here's exactly what I'll walk you through. First, I'll explain why walking every day is not enough to protect your legs after 60, especially with diabetes and what your muscles are actually starving for. Second, we'll uncover the 5 silent reasons your legs feel weak, including the one doctors miss in almost 70% of cases I review. I'll tell you the real-life story of Margaret, 68, who thought she needed a wheelchair until we found her invisible thief. Third, I'll give you the simple at-home checks you can do tonight to see if any of these reasons apply to you. No equipment. No guesswork. And finally, I'll share the exact daily habits, the foods, the timing of your medications, and the one nighttime routine that helped my patients feel stronger and steadier, sometimes in as little as 14 days. But before we go there, I want you to think about something. Remember when you were younger? When you could stand for hours, chase the kids, dance at a wedding, and never once think about your legs? That's strength. It isn't completely gone. It's just buried. Buried under blood sugar swings, under nutrient gaps, under habits we thought were healthy but weren't enough. And today we start digging it back out. Because here's the truth nobody tells you. Leg weakness is not a death sentence for your independence. It's a signal. A warning light on the dashboard. And once you know what that light means, you can fix the engine before it breaks down. So take a deep breath with me. You're not alone in this. And you're not too late. If your legs feel heavier than they did last year, if you've caught yourself holding the wall more often, if you've said no to an outing because you weren't sure you could keep up, then this conversation is for you. Stay with me. Because in just a few minutes, I'm going to reveal reason number 5 and why the common advice of just build more muscle can actually backfire if you have diabetes. And later, When we get to reason number 3, the one doctors miss, you'll understand why so many seniors suffer in silence when they don't have to. Your strength, your balance, your freedom, they're worth fighting for. And it starts right now. Let's go deeper together, and I want you to really feel this because understanding is where your power begins. Now, before we talk about the 5 silent reasons, I need to clear up a myth that keeps so many good people stuck. You've probably heard it from friends, from family, maybe even from a nurse. If your legs are weak, just walk more. Just do more squats. Just push through it. And on the surface, that sounds right. Movement is medicine after all. But with diabetes after 60, that advice can quietly make things worse. Let me explain why, and I promise I'll keep it simple. When you have diabetes, especially for many years, your body changes the way it handles 3 things: sugar, blood flow, and nerves. And your leg muscles, they're like a car engine. They need fuel, they need oil, and they need electrical signals to fire properly. If you're low on oil, flooring the gas pedal doesn't help the engine, it grinds it down. That's what happens when we tell a 68-year-old with diabetes to just walk more when the real problem is that her muscles aren't getting the right nutrients, or her nerves aren't firing, or her blood flow is blocked like a clogged pipe. More walking without fixing the root causes like telling someone to run a marathon with a flat tire. You won't get stronger, you'll get hurt or tired or scared. And then you'll stop moving altogether. And that's when the real decline begins. I remember Margaret, 68, from Ohio. She was a retired teacher. Diabetes for 15 years. She came to me holding her daughter's arm, eyes full of tears. She said, "Doctor, I used to walk 2 miles every morning. Now I can barely make it to the mailbox. My legs feel like wet cement." My own doctor said my A1C is fine, so it must just be age. But when we looked closer, her A1C wasn't the problem. Her invisible thief was. And it had nothing to do with how much she walked. So let's talk about reason number 5 first, because it's the one everyone talks about, but most people misunderstand. Sarcopenia. That's the medical word for age-related muscle loss. After 60, we all lose muscle every year, about 1 to 2%. Doesn't sound like much, but over 10 years, that's 10 to 20% of your strength gone. Now add diabetes to the mix. High blood sugar, over time, damages the tiny structures inside your muscle cells. It's like rust forming inside an engine. So you're not just losing muscle from age. Diabetes speeds it up. And here's the kicker. The first muscles to go are usually in your thighs and your hips. The exact muscles that lift you out of a chair, that keep you steady on stairs, that catch you if you trip. That's why it feels sudden. One day you're fine, and 6 months later, standing up feels like a workout. But, and this is important, sarcopenia is not a life sentence. It's not just old age. Because muscle is one of the few tissues in your body that can rebuild at any age. I've seen 80-year-olds put muscle back on. The problem is most advice skips the first step. You can't rebuild a house if the foundation is flooded. And with diabetes, the flood is inflammation, poor circulation, and nutrient gaps. Fix those first, and the muscle comes back faster than you think. Now, reason number 4 is something your doctor probably did check, but maybe didn't explain well: poor circulation, or what we call PADAD, peripheral artery disease. Think of your arteries as garden hoses. After years of high sugar, those hoses get stiff and they get narrow. So when your leg muscles ask for more blood, like when you're walking, they don't get it fast enough. The result? That cramping, that heaviness, that I need to sit down right now feeling after just a block or 2. Many people call it getting old. Doctors call it claudication. I call it a warning light. Because if your legs aren't getting blood, your heart might be struggling too. But here's the myth. People think if they don't have pain, they don't have PAD. Not true. In diabetes, nerve damage can hide the pain. So your legs just feel weak or tired or dead. No pain, just weakness. And that's why it gets missed. Reason number 3. This is the one doctors miss. And I want you to remember this part. It's not neuropathy. It's not circulation. It's electrolyte imbalance, specifically low magnesium and potassium. Now stay with me because this is where it gets human. You see, your diabetes medications, especially water pills and even some common blood pressure meds, can quietly flush magnesium and potassium out of your body every single day. And magnesium is like the spark plug for your muscles. No magnesium, no spark. Your muscles can't contract properly. Potassium is like the battery. Low potassium and your legs feel drained, shaky, like they might buckle. The cruel part? Standard blood tests often come back normal because only 1% of your magnesium is in the blood. The other 99% is in your bones and muscles. So you can be deeply deficient and your labs will still say you're fine. I've seen seniors whose legs came back to life in 2 weeks. Not from a new prescription, but from fixing this one quiet imbalance with food, timing, and talking to their doctor about their meds. And no, the answer is not just eat a banana. It's deeper than that, and we'll get to the exact steps in the next part. But before we move on, let me tell you about reason number 2. Because this one scares people the most. Nerve damage. Diabetic peripheral neuropathy. When sugar stays high for years, it burns the tiny endings of your nerves, like fraying the wires in a lamp. The lamp flickers. Your muscles don't get the clear signal to contract now, hold now, balance now, so your legs feel weak, even if the muscle is still there. Some people feel burning or pins and needles, but many, especially after 60, feel nothing. Just weakness, just unsteadiness. And they think, well, my feet aren't numb, so it can't be neuropathy. But neuropathy has many faces. Sometimes it's silent. Sometimes it just steals your strength. And finally, reason number 1. This one ties them all together. Spinal problems, sciatica, herniated discs, stenosis. As we age, the spaces in our spine get narrow. If you have diabetes, inflammation makes it worse. A pinched nerve in your low back doesn't always cause back pain. Sometimes the only sign is weak legs, or a foot that slaps when you walk, or a knee that gives out for no reason. I've had patients get knee replacements they didn't need because the real problem was in their spine. So let's pause here and breathe. If you see yourself in 1 or 2 or even 3 of these reasons, please don't panic. Because knowledge is not a verdict, it's a map. And a map means there's a way out. You're not just old, you're not just diabetic. You're a person with a body that's sending signals. And now you know how to read them. In just a moment, I'm going to show you exactly what to do starting tonight. The simple chair test that tells you if circulation is your issue. The one food to eat before bed that helps your muscles hold on to magnesium. The common breakfast mistake that makes reason number 3 worse for 8 out of 10 seniors. And the 2-minute wall habit that wakes your nerves up before you even take a step. But remember this, you didn't get weak overnight. And you won't get strong overnight. But you can feel safer, steadier, and more hopeful starting this week. Because your legs don't need to be 25 again. They just need to be strong enough to carry the life you love. And that is absolutely possible. Let's talk about what you can actually do starting today, because information without action just creates more worry. and you've worried enough. Right now, I want you to sit somewhere comfortable. Take a slow breath with me, and know this. Your body wants to heal. It wants to be strong for you. It's just been missing a few pieces of the puzzle. So let's put those pieces back one by one, gently, safely, and in a way that respects where you are today. First, let's protect you tonight. Before you go to bed, do this simple chair test. Sit in a firm chair, feet flat on the floor. Now, without using your hands, try to stand up. Then sit back down. Do that 5 times. If you feel wobbly, if you have to push off with your hands, or if your legs shake by the 3rd time, that's your baseline. We're not judging it. We're just noticing it. Write it down on a piece of paper or in your phone. In 2 weeks, we're going to do it again. Because progress isn't always a big dramatic moment. Sometimes it's standing up 1 second faster. Sometimes it's not reaching for the armrest. That's how strength comes back, quietly, then all at once. Now, about that invisible thief, the magnesium and potassium gap. Here's what I've seen help so many seniors, and I want you to hear this part clearly. Food first, always. Before you think about any supplement, before you change anything, talk to your doctor. Because with diabetes, and especially with kidney issues or certain heart medications, even natural things can interact. But here's the truth. Most of us after 60 are not eating enough of the foods that keep our muscles firing. A small handful of pumpkin seeds in the evening, or half an avocado with dinner, or a cup of cooked spinach at lunch. These are real foods, gentle foods, that give your muscles the spark they've been missing. And timing matters. Many of my patients do better when they have those mineral-rich foods with their evening meal, not on an empty stomach. Why? Because at night, your body does its repair work. And if your muscles have what they need before you sleep, they wake up a little stronger. Here's a common breakfast mistake I see every week. And it breaks my heart because people think they're doing the right thing. They take their diabetes medication, maybe a water pill with just black coffee and a piece of toast. Then they go for their morning walk. But coffee and those pills can flush water and minerals out, and toast alone doesn't replace them. So by 10 a.m., their legs feel like lead. If that's you, try this tomorrow. Take your morning medications with a full glass of water, and within 30 minutes, have something with protein and minerals. A scrambled egg with a little spinach. Or plain Greek yogurt with a few almonds. Nothing fancy. Just real food that tells your body, I'm safe, I'm fed. You can send blood to my legs now. Let's talk movement, but not the kind that scares you. You don't need a gym. You don't need to sweat. You need to remind your nervous system that your legs are still here, still working, still trusted. So here's the 2-minute wall habit I teach every patient. Stand with your back against the wall, feet about a foot away from the wall, just like you're about to sit in an invisible chair. Now slide down just 1 inch, just 1 inch. Hold it for 5 seconds, come back up, breathe. Do that 3 times. That's it. You're not building bulky muscle. You're waking up the nerves that go from your spine to your thighs. You're telling your brain, hey, these legs still matter. Do that every morning while your coffee brews. Do it before you brush your teeth at night. Consistency beats intensity every single time. Now, for circulation, for those stiff, narrow hoses we talked about, warmth and gentle motion are your friends. After your shower, when your skin is still warm, sit on the edge of your bed and point your toes down, then pull them up toward your knees. 10 times, slow, like you're pumping a pedal. This is an exercise. This is plumbing. You're helping your calves push blood back up to your heart. And if your feet are always cold, talk to your doctor about whether simple compression socks during the day might help. Not the tight medical ones right away. but the gentle kind you can buy at the pharmacy. For many seniors, that one change means less swelling, less heaviness, and more confidence walking to the mailbox. Let's be honest about mistakes because shame keeps people stuck. Mistake number 1: doing too much too fast. If you haven't walked in months, don't start with a mile. Start with the walk to your kitchen and back twice. Mistake number 2: ignoring pain that's new or sharp. Soreness is okay. Sharp, shooting pain is a stop sign. Call your doctor. Mistake number 3: changing supplements or medications without your care team. I know you want to feel better yesterday. I want that for you too. But safety is the foundation of strength. So every change, every new habit, run it by your doctor or pharmacist first. You are the CEO of your health, and they are your expert advisors. And here's the most important habit of all, and it has nothing to do with food or exercise. It's how you talk to yourself. If every time you stand up you think, my legs are failing me, your body listens. But if you say, my legs are learning to be strong again, your nervous system starts to believe it. I know it sounds simple, but I've watched it change lives. Because hope is not a feeling. Hope is a practice. And you're practicing it right now just by being here with me. So tonight, before you sleep, do 3 things. First, the chair test, just so we know where we're starting. Second, have a small mineral-rich food with dinner, a little avocado, a few pumpkin seeds, some cooked greens. Third, stand against that wall and do your 1-inch slide. 3 times, that's it. No pressure. No guilt. Just 3 small acts of kindness to your body. And tomorrow, when you wake up, I want you to notice something. Maybe it's nothing. Maybe it's just that you stood up a little easier. Or maybe you didn't think about your legs for the first 5 minutes of your day. That's progress. That's your body whispering, thank you. I'm working on it. In our final part together, I'm going to share Margaret's full story, what she did week by week, and the moment she realized she wasn't going to need that wheelchair after all. I'll also give you the 1 sentence to say to your doctors so they take your leg weakness seriously, and the simple way to track your strength so you actually see it coming back. Because you deserve to feel safe in your own home. You deserve to walk without fear. And you deserve to know that after 60 with diabetes, your story is not over. It's just entering a new chapter. Let me tell you what happened with Margaret, because her story is really your story too. When she first came to me, she had already picked out a wheelchair. Not because she needed it that day, but because she was afraid of the day she would. Her daughter had moved her bedroom downstairs. Her grandson stopped asking her to come to his baseball games. And in her own words, she told me, I feel like I'm disappearing, 1 step at a time. We started with the same 3 things I shared with you. The chair test, the evening minerals with dinner, the 1-inch wall slide. That was it. No crazy workouts. No expensive machines. Just small, faithful steps. The first week, nothing changed. The second week, she called me and said, I stood up today and didn't grab the table. Week 3, she walked to the end of her driveway. Week 6, she sent me a picture. She was at the park, on a bench, watching her grandson play. No cane. No daughter's arm. Just her, smiling with the sun on her face. And she wrote under it, I thought I was saying goodbye to my legs. Turns out, I was just saying hello again. And that's what I want for you. Not to run a marathon. Not to be 30 again. But to say hello again to the parts of you that feel lost. To the morning walks. To the kitchen where you cook for people you love. To the simple freedom of standing up without fear. Because after 60, with diabetes, your life is not shrinking. It's waiting. Waiting for you to give your body the right signals, the right fuel, the right kindness. So let's remember what we learned together. Your legs aren't weak because you're old. They're weak because they're missing something. Maybe it's muscle that needs to be rebuilt slowly and safely. Maybe it's blood that needs a clearer path with warmth and gentle motion. Maybe it's nerves that need to be woken up 1 inch at a time. Maybe it's minerals that your medications have been quietly washing away and that food can quietly bring back. Or maybe it's your spine asking you to pay attention before anyone thinks about your knees. And maybe, just maybe, it's reason number 3, that invisible thief, the one doctors miss but you won't anymore. Because now you know to ask. And that brings me to the one sentence I want you to say to your doctor. Write it down if you need to. At your next visit, look them in the eye and say, I've been learning about how magnesium and potassium and my medications might be affecting my leg strength. Can we check if that could be part of my case? That's it. You're not demanding. You're not diagnosing. You're inviting them into the conversation as a partner. And any good doctor will lean in when they hear that, because it tells them you're paying attention to your body. And your body is worth paying attention to. Here's how you track your strength, so you don't miss the quiet wins. Once a week, same day, same time, do that chair test. 5 sit-to-stands, no hands. Time yourself if you can. Write it down. Not to judge yourself, but to witness yourself. Because one day, you'll look back at that paper and realize I'm not who I was 3 months ago. I'm someone new. Someone stronger. Someone who didn't give up. I know there are days when it hurts. Days when the fear is louder than the hope. Days when you wonder if it's too late. Let me tell you, from 30 years of sitting across from people just like you, it's not too late. Your muscles can learn. Your nerves can wake up. Your blood can flow better. Your balance can return. Not all at once. Not perfectly. But enough. Enough to go to the wedding. Enough to hold your grandbaby without sitting down. Enough to walk into a room and not scan for the nearest chair. And if no one has told you this today, let me be the first. You are not a burden. You are not broken. You are a human being who has carried a lot for a long time, and your legs are just asking for a little help. And now you know how to give it. So here's my soft ask to you. If this conversation made you feel even 1% more hopeful, tap that like button. Not for me. For the next person who feels alone in this, so the algorithm knows to show them they're not. If you want more calm, clear, trustworthy guidance on living strong after 60, subscribe and come back next week. We'll talk about blood sugar and sleep, about balance and the inner ear, about all the things no one told us we'd need to know. And in the comments, tell me just one thing. Which of the 5 reasons felt most like you? Or what's one small win you had this week, even if it was just standing up a little taller, because when you share, you heal someone else. And we all heal better together. You've stayed with me to the end, and that tells me everything I need to know about you. You're not giving up. You're showing up for yourself, for the people who love you, for the life that's still waiting to be lived. So tonight, be gentle with yourself. Do your 3 small things. And when you lie down, place your hand on your heart and say, "Thank you, legs. I'm listening now." And we're going to get stronger together. I'm proud of you for being here. And I'll see you in the next one.